How many people are here from San Diego or the San Diego area? Okay. Thank you for coming all the way up here.
If you're here from there and you're not in our tumor support group, you need to be. So talk to one of us before you leave.
So this is Tom Gergen, who is one of the members of the San Diego NET group. And you may see on your program, this is called the Jan Naritomi-Hart Lectureship. This is the first inaugural talk under this program. And Jan she actually started the San Diego group. She was a patient, and she passed away a few years ago. And her sister and I have been working on ways to really honor Jan. And if you knew Jan, some of the things that were really important to her were nutrition and alternative support. She'd be like, no, it's Tuesday, I'm doing meditation and massage, and so we really wanted to honor Jan with something special. And perhaps Tom can say a few words about Jan and the San Diego group.
No, she was really important to the NETS community in Southern California widely. I think she really fell into starting the group by accident. She started meeting patients for walks and going to the beach and seeing them at doctors' offices, and this grew into becoming a support group. And then it took about 8 of us to fulfill her legacy, just to keep it going. That's how much she was doing full-time. And that's just to run the support group. She did so much beyond that. It was a full-time job for her, full-time, not a job. She loved it, but it was full-time for her. We can't do that, so we haven't even been able to come close to doing what she could do. So it's a wonderful thing, I think, that you've done to set this up, because she did support complementary therapy and good nutrition. Actually, on an aside, I've come to the point in my life where I want to get the most preservatives in my food I can, but for everybody else, you probably want to eat more healthy. So anyway, thank you for asking a representative from the group to come here and say a few words about Jan. Wonderful lady. We called her St. Jan.
And she was absolutely a dear friend. So with that, I would like to introduce Carolyn Katzin, who is our speaker here today, to talk with us about nutrition. She's an integrative oncology specialist who is working out of UCLA, the Sims-Mann Center for Integrative Oncology. And she is familiar with neuroendocrine tumors. And please give a warm welcome to Carolyn Katzin.
Thank you so much to Giovanna and the organizers. I'm just very honored to be here, and to an amazing audience. I'm really thrilled that everybody came. So we're going to talk a little bit about part of what in your lifestyle, something you can do, because every day we eat. And I know a lot of times it feels like things are being done to you, but this is something that you're able to do. And one way we can think about this is to think about how health is really a dynamic balance between the mind, the body, and the spirit. So when we talk about having a diagnosis of cancer, we're always, of course, thinking about the body in large part, but also the mind. But it's important to remember the spirit, too. And part of the reason why integrative approach is helpful is because for some people, and especially within their family or community situation, one or other of those may be more important for them. And at UCLA, we started, actually the center was originally started for breast cancer patients. And if you're getting treated at UCLA, there is a full psychosocial support, and I will talk a little bit more about them. But the concept of having an integrative oncology specialist was something that was started relatively recently, because I think it was aware that symptom management helps with your quality of life, and of course it helps you to maintain health and well-being. Now, obviously, I'm just summarizing here that I'm going to be talking more about carcinoid because, and that is a malignant, secretory, well-differentiated type of tumor, but you all know that in the room. And maybe one of the questions you might say is, what should I do? Should I stop eating sugar? Should I stop drinking coffee? What is the most important thing for me? And of course, everybody's different. Everybody's situation is different. And it is important to kind of think about what would improve my overall well-being. And for most people, small, frequent meals, rather than trying to have one large, what you might call a dinner, is helpful. And part of it is because we're dealing with changes in motility and changes perhaps that affect the absorption of many of the fat-soluble vitamins, A, D, E, and K. And some of these are perhaps challenges. We can think about it that way, but how do we monitor all these different things? And there's certain things that are more important than others. Your blood sugar control is important, not so much because of the blood sugar as insulin. And another important thing is B3, and we'll talk a little bit more about that in a minute. I mentioned the fat-soluble vitamins, B12, and of course, the anxiety and stress management is very, very important. So at the center, which is what it is here on the 5th floor at UCLA, we have many different modalities that we offer. I know later on you're going to hear from someone else who is at the Mark Institute. So here there's a website, and many of the ancient traditions that people have used, maybe more from the focus of the spirit, have actually been able to be translated into our modern day. And so we have ways of being more present in the moment. Even a 1-minute meditation of you being present in the moment can help to lower your heart rate, as I was trying to do in that room, in that seat right before I started to speak. Qigong is something that we offer. Every week we have a Chinese master who does a very slow movement and using breath. And breath is incredibly important for many, many reasons. Breath is the main way that we normalize pH. And I see a lot of people who come in and say, should I be drinking alkaline water? And I say, well, how about doing some deep breathing? And obviously exercise forces you, makes you to breathe more deeply. The spirit, I mentioned that before, but sometimes it's helpful to just be still. You know, in this world, we're so busy, a 24/7 news cycle, everything's always chaos, chaos, chaos. Sometimes it's a matter of just trying to be still. And music actually has tremendous benefits for health. And of course, Giovanna's music has been really nice in our breaks. So looking at nutrition in particular, one of the concepts that I've kind of come up with, a sort of story, if you like, what I call the 3 A's, which is antioxidants, anti-inflammatories, and anti-carcinogens. Well, if one of the things that I learned in preparing for this talk is that actually serotonin is a very powerful antioxidant, but anti-inflammatories and anti-carcinogens are probably more important. Berries happen to be very, very rich in all 3. So let's focus a little bit on serotonin and what can be done in terms of serotonin management and what serotonin is all about. I also learned while preparing for this talk too that there's a word called Phyto Serotonin, because serotonin is in fact in many, many different plants and in fact throughout nature. And 90% of the serotonin in your body is actually in the gastrointestinal tract. So what is also happening in the future, and what we will be learning a lot more about, is how the microbiome, which is actually the ecology or the world that is in our intestinal tract, how that interacts with the serotonin in our body, and how the microbes, in fact, are playing a very important role in our overall health. There is a deficiency of niacin. It's a kind of complicated thing where if tryptophan, instead of being used to make B3 is basically a sort of side way of tryptophan being used. And if it's all being used to make serotonin, there could actually be a mild deficiency of vitamin D3. And pellagra is a word that was used for people who had real frank deficiency of B3, and the symptoms are diarrhea, dermatitis, and dementia. So if we look here, I know earlier on we were talking about the 5-HIA test and how it's important to not be eating high serotonin foods prior to that test. So for at least 24 hours, maybe a little more, you don't want to be having these foods. And that's because it can affect the test itself. And so the higher serotonin foods are here. These are moderate. And you can also find, for anyone who would like it, I can give you a more detailed list. Carcinoid syndrome is something that is maybe the flushing may last for a few hours, and it's something that can be quite troublesome for many people. And there are some triggers, and typical triggers, for example, might be alcohol or caffeine for the flushing. And there are many foods that are containing a lot of what we call biogenic amines, and these are essentially associated with microbial action of spoilage. And so, you know, if foods smell ammonia-like or fishy-like, then you definitely, those are going to be high in these biogenic amines. But because everybody's different, it's a really good idea to keep a journal so that you know if you did have carcinoid syndrome symptoms, what had you been eating and drinking in the few days before, and see if there's something that you can journal to avoid. Here are some typical examples of some foods and some reasons as to why you would want to avoid them. And as I mentioned, molds and aging of foods, so that things that are fermented or pickled are more likely to have had that microbial action, and that would be more of a problem. And one of my favorite foods, of course, is chocolate, and that is also high in phenylethylamine, which is another amine. These are usually fairly safe to eat because they would not trigger the carcinoid syndrome. And these would be meats that were very fresh. Obviously, grass-fed, organic is always good. Fish and shellfish. Fish actually have they're unusual in nature in as much as they have nothing to stop them from spoiling. And that's why fish has to be eaten so fresh. So if you have fish, it should be either frozen, because they freeze it on the boats, or extremely fresh, because otherwise it will spoil really quickly. We've been hearing a little bit about the somatostatin analogs and the therapies and some of the side effects. And so these are some of the common side effects that you might see. So we're going to talk about some of those. Because if you have all of these problems, even if you want to do the best thing in the world and you want to eat healthfully and you want to be eating all the right things, you may find it very difficult if you have some of these. So we'll look at each of these in turn. So for example, nausea. If you're nauseated, it's really hard to eat. And ginger can be very helpful. One thing about ginger, you can use it as a flavoring, or we actually, we have a small store that the proceeds supports the not-for-profit center, Simsman, and there we have ginger essential oil. So sometimes when people don't actually want to even put anything in your mouth, you can just hold it under your nose, and it is very, very safe. The way food looks is important, too. A garnish can make a big difference to whether you find something appealing or not. This is about ginger and why it's helpful. So glycemic load is a concept that we've been hearing a little bit more about recently, because gly means sugar, emic blood. Glycemic load means the combinations of different foods and how they affect your blood sugar levels. And it is important because if you have a lot of swings of your blood sugar up and down, you can be feeling much less your energy levels are also affected by that. But you also have to be careful with caffeine, not only because of the flushing, but also because it may keep you awake at night, and sleep is very, very important. This is an old study that I pulled up because it really explains why blood sugar levels are affected by the way that the food is presented. So this is the same amount of carbohydrate in a different form, whether it's a fresh apple or the apple juice, and it's exactly the same amount of carbohydrate in all of them. And you can see that the fresh apple is handled very differently than the apple juice. This is another way of thinking about your digestion, and I find a lot of people get confused about enzymes and probiotics and prebiotics. And basically, enzymes are what are helping your body to digest food and make it more accessible so that you can use it for new cells and for energy. Prebiotics is another word for dietary fiber, and essentially there are different types of fibers. And talking about the microbiome again, that's where these microbes, which are basically those that support health, we call probiotics. And these are live cultures that live in our digestive system. And in fact, the weight of the bacteria in our digestive system is similar to the weight of our brain. And it's very, very active. So we need all three in balance. And many people get confused with that, and that, but they're all slightly different. So digestive enzymes, traditionally, they also exist in nature. So papaya, for example, or pineapple, these have proteases. These are enzymes that are proteins that help to break down protein-rich foods and make it more absorbable and more accessible. Foods that help support healthy colon functioning, these are ones that contain both prebiotics, which are the fiber, and also the healthy probiotics. So complex carbohydrates, what that means is simply not the simple sugars that we use directly, but they are made in combination. They are basically what plants use as their structure. So you don't find dietary fiber in animals. You only find it in the plant world. So if you only find it in vegetables, beans, salad vegetables, and these are very important for our microbial balance. There's a concept that you may begin to see a lot more of because the food industry is introducing it, called resistant starch. And resistant starch is really another way of describing this, about how the starch is broken down, and if it's resistant to being broken down, then it actually normalizes, go back to the glycemic load story. So we've talked a little bit today, and I've heard a lot more about diarrhea, and I realize that the type of diarrhea that we're talking about in a carcinoid situation can be very intractable. However, these are some, general ideas for typical type of diarrhea that maybe results from not so much that over-expression of serotonin. And hydration, of course, is very, very important. Now, it doesn't have to be alkaline water. It doesn't even have to be tea or coffee or whatever, but just plain water. But it's just important that we get sufficient fluids, but not too many, because it's also possible. I often say that things have a J-shaped curve. Too little isn't good. Too much isn't good. You could call that the Goldilocks principle. So we also have to be careful of that. And here's some other ideas about hydration. I saw a patient a few days ago who was drinking every 2 hours 10 fluid ounces and going to the bathroom so frequently that really she was at a risk of irritating her kidneys. So, because a little is good, a lot may not necessarily be better. Depression is a really important topic, and I think it's important because a lot of times the barriers to why we're doing things healthily for ourselves may be because we're actually depressed. And I don't mean deep clinical depression, I mean just down, having a lot of down days. Or if you're a loved one and you see somebody who's just not doing things that you expect them to normally do for themselves, then it's worth asking, how are you feeling? Are you feeling sad? Often people will say they feel sad, whereas the word depression is like a harder word to access. And then there are some things that might help you, but pretty much everybody benefits from a hug and from love. Insomnia can be a big challenge for many, many people. And part of it is because when you're stressed, you sleep more lightly. And often if you wake around 3 or 4 in the morning, I always say to patients that is the worst time to go on the internet. It's like your judgment part has gone to sleep too. And I recently had a patient from South America who gave me a different way of thinking about this. He was saying that actually between about 3 and 4 in the morning is called the golden hour, because it's when your mind is actually in a more creative, open, and spiritual place. So if you think about it that way, it can maybe allow you to be more peaceful and quiet in bed and not get up and try to be in that judgmenting research place. Because that's where people, find that they are, falling for the hoax cures and things like that. Dermatitis, we talked about diarrhea, dermatitis, and dementia, but I want to just touch a little bit on dermatitis. There are some foods that may, if you add them in large quantities, can irritate the skin. We know this because people who have vitiligo, for example, they can be given these foods, their skin gets a little red, then they treat it and it darkens. So we know that those in large quantities can be skin irritants. So if you do have a rash and you do have a problem, then don't have large quantities of these. Essential fatty acids, the omega-3, 5, and 7, especially omega-3. Nowadays, actually, I think in San Diego, DHA from algae is farmed. So instead of having to have it from fish, you can also get it from algae, so it doesn't have that fishy aftertaste. And that's why you're seeing more and more foods with omega-3 added, because of it coming from algae. So to enhance mental clarity, I thought rather than talk about dementia, there are certain foods that can help your brain be more clear, to think clearly. Lecithin is an emulsifier that exists naturally in nature, and egg yolks are rich sources of that. And phosphatidylcholine, phosphatidylиnositol, phosphatidylserine, those are all forms of lecithin. It's sort of like lecithin's a bigger word for that. Phosphatidylserine is supposed to be beneficial for memory. And of course, the B vitamins are very, very important. B vitamins, B, zinc, and magnesium are cofactors in pretty much every enzyme in the body. So when we talk about enzymes, those are what do the work for us. Those make life happen. Without enzymes, we just wouldn't be alive. How do we participate then in your own nutritional health? So we dealt with some of the barriers to why you might not be able to be eating the way you want to. It can be helpful to have somebody assist you. I was very gratified to hear the physicians talking about the importance of a nutritionist. It's important to get the right type of nutrition advice. You do need to talk to somebody who is experienced with this type of a cancer and this type of situation, because just giving somebody very general advice may or may not be helpful. Your resilience and your energy does depend a large part on how much you're eating on a regular basis. We can certainly go for several days not eating well, having diarrhea, being dehydrated, and that's not the end of the world. But if you're continually doing that, you're going to feel more fatigued, not sleep as well, and not be able to be as resilient. One of the first things that I do when I work with people is find out exactly and precisely how much protein they need on a daily basis. And that's very important because most of the protein-rich foods are also rich in the nutrients that are important for your enzyme activity. The zinc, the magnesium, the B6, and B3, of course. Some people say, well, what about organic? Should everything be organic? The Environmental Working Group is a not-for-profit organization that actually publishes a shopping list that you can take where they talk about the Dirty Dozen and the Clean 15. And basically, certain foods like strawberries and apples tend to have a higher pesticide load, so those would be worthwhile getting organic. Because you don't want to be adding to the burden of your liver and kidneys when it's dealing with so many other things. These are some plants that actually have real benefit in the sense that they stimulate liver enzyme activity to detoxify and to maintain a healthy balance of microbial activity. And these are the family of the garlic or allium family. These are chives, garlic, of course, and I recommend everyone try to have at least 1 or 2 of that family every day, and 1 or 2 of the cabbage family. However, I did notice that Chinese cabbage happens to be very high in serotonin. Ellagic acid is found in many berries, and berries have tremendous benefit, especially the darker colored ones. Black raspberries in particular have been shown to be beneficial. And what would a typical menu look like? It might look like this, although if your system is very, very sensitive, you may want to be working with texture, so you wouldn't be having sharp textured foods. I often talk to people about don't have nuts, have nut butters. And a lot of people now have very strong engined blenders that you can use that will actually pretty much blend all of the nuts or seeds into a milk or a butter. So this is just an example of a typical type of diet. So what would you do? In general, we should be eating fish regularly, but of course the fish needs to be very, very fresh. We should definitely be having fruit, and the colorful fruits would be important. The typical meal pattern that I give to people is called the Mediterranean diet. The Mediterranean diet is essentially very colorful, rich in olives and nuts, and has plenty of fish, and has got really minimal amounts of saturated animal fats. But every one of us is different, and so just because for one person this diet might work, for somebody else it might not. Even within the same family, you might find, Jack Sprat and his wife could eat Jack Sprat could eat no fat, his wife could eat no lean. I mean, we are all very different. And, once we've dealt with some of the side effects that are acting as barriers, then I think it's just important for eating for pleasure too, because pleasure of food is really important. So in summary, we want to talk about the 3 A's of health: the antioxidants, anti-inflammatories, and anti-carcinogens. I would just like to point out that some of the culinary herbs, such as oregano and thyme, which contain thymol, which is a very, very helpful antibacterial, and also turmeric, which is a source of curcumin, these can actually be very beneficial in preventing the formation of amines in the digestive tract, and also in foods in general. Fresh, locally grown, and seasonal it kind of makes sense, but also organic berries are very, very helpful. And of course, you want to be as active as you can, and of course, be well. When I see patients, everybody gets a copy of my book, and I always sign it with my name and be well, because I feel that's important. And the wellness means how do you feel, on a daily basis, on a momentary basis. This is a quote from Albert Einstein, which I always love because, nobody was more brilliant than him. There are only 2 ways to live your life. One is as though nothing is a miracle. The other is as though everything is a miracle. And as I said, love is the most important thing. Thank you.